We need to have a tea party.
Every day is a celebration for 2-year-old Delaney Sacks. She and her twin brother Barrett were born 24 weeks and 5 days into what until then had been a normal pregnancy.
Delaney weighed 1 pound 10 ounces and Barrett weighed 1 pound 8 ounces. This bottle of water is what they weighed.
Their body was about the size of your hand. Their arms were maybe as long as your finger, and their legs were just a little bit longer. And it was very hard to see that.
Their hearts and lungs still needed to develop, and infection was a huge concern. Sadly, Barrett passed away at 9 days old. Delaney would spend 109 days at Stormont's NICU.
We had lost Barrett, but we still had another child that we needed to be strong for, that was continuing and fighting for her life every day.
The NICU is a very stressful experience for parents.
Dr. Sue Hall is medical director at Stormont Vail's NICU. She says parents of babies in the NICU are at higher risk for postpartum depression and post-traumatic stress disorder, so support is critical.
We need to go down the slide.
Stormont works with the March of Dimes to offer support groups and educational material, and staff receive special training on meeting parents' emotional needs and understanding what to expect.
Premature babies' behavior is kind of limited by the fact that their brains haven't finished developing. So parents might expect a normal baby to smile at them or to coo, and our little babies aren't doing that, and parents might feel kind of left out.
11.
Rachel and Robbie say the support was vital, especially when they met other parents of preemies.
Just nice to be able to talk to somebody who understands what you're going through.
Delaney came home with a feeding tube, but shed that within a year, and today is basically caught up with her peers. Pretty big steps for a life that started so small.
It's been pretty remarkable how well she has done.
It's been just amazing to see how she's grown, how she's changed.
The fact that Mason Busey is even here to mug for the camera is in itself a miracle.
And they gave us probably a less than 3% chance that he would survive the pregnancy.
At 20 weeks, an ultrasound revealed Mason had a fluid buildup on his neck called cystic hygroma and atrioventricular septal defect. Instead of being divided by chambers and valves, his heart had not developed.
We went in and thinking everything was okay, and that day just rocked our world. We kind of planned a funeral instead of a birth.
But instead of sliding downhill, Mason defied the odds. The hygroma, thought to be fatal, resolved itself. But still, Mason was born with Down syndrome and that undeveloped heart.
There is no self-healing or spontaneous cure for it.
Dr. Ken Gertz of KU Med is Mason's pediatric cardiologist. He says a defect like Mason's requires surgery. Without it, pressure backs up in the small vessels and lungs.
A child, as they go into teenage and young adult years, becomes bluer and bluer. They become markedly limited in physical activity.
They also likely won't live past their 20s. So at 5 months old, Mom and Dad handed their little boy over for surgery.
It was rough. You go into it hoping for the best, but you always know in the back of your mind that, something bad could happen.
Despite being hooked to a tower of machines, the difference was immediate.
The first words out of my mouth was, "He's pink." For the time he was born until before his open heart surgery, he was gray almost.
26 days and a bout with pneumonia later, Mason headed home. And he's been rocking the milestones ever since.
For him to walk and talk and run and climb and get into mischief, it has been an amazing journey to see what he has accomplished.
Not a day goes by that Stacy Dieter doesn't think of her cousin Lisa Chapman.
Her smile would light up a room.
Stacy's children, Kaylee, Brody, and Karis, also remember the woman they called Aunt Lisa.
She always talked to us and we did fun stuff to her and all that.
Stacy says Lisa's diagnosis with breast cancer would have been harder to take if it weren't for Lisa herself.
Everybody kind of thrived off of her positiveness. She never was down. She never let anybody know that she was scared, sad.
After Lisa's death, Stacy and her husband brainstormed how they could pass along to their children Lisa's desire to make the world better for those around her. They thought of giving them money to hand to strangers, but Kaylee had a different suggestion, one that involved children who, like Aunt Lisa, had cancer.
When I saw Lisa kind of like did the pain, I'm like, oh yeah, that's kind of hard for her.
To make it easier on the youngest cancer patients, the Dieter kids went shopping and delivered a load of blankets, movies, activity books, and stickers, along with a Wii system and games for the pediatric patients at the Stormont Vale Cancer Center.
They need to forget about their sickness and had fun.
They really love it, so thank you so much.
Pediatric oncologist Dr. Yumna Offman says cancer treatments can be especially tough for kids.
Some of the treatments can last all day long.
Studies show lifting their spirits with video games or coloring books can have an actual physical impact.
The less of a trauma it is, the more of a normal childhood behavior they can have, the better outcome they have.
Which is exactly what Lisa would want for her husband, sons, and all those she left behind to make things easier for someone else.
Lisa's legacy is just brightening somebody's day. She did that for all of us, and now it's our turn to brighten somebody's day.